if we hadn't come here to UW,
Hello, hi, good to see you.
I don't know what would happen.
Here at the University of Washington and the Seattle Cancer Care Alliance, we often see patients for second opinions regarding how to manage their cancer.
Todd Brayman was diagnosed with prostate cancer in 2004.
This diagnosis and treatment journey that I've been on has been probably the most enlightening experience of my life.
The diagnosis came kind of in pieces.
He underwent radiation, hormone therapy, and chemotherapy in his hometown of Yakima. But one after another, each of those treatments stopped working.
In the beginning, I had hope it would be curable, and the hopes were dashed in 2008. We were on watchful waiting, and July 1st, 2008, he was diagnosed with metastatic stage 4 prostate cancer. And I realized that cure is not possible, so I tried to concentrate on treatment.
Todd and his wife Helga wanted a second opinion. Their daughter had recently graduated from the University of Washington.
What motivated you to come here?
And she recommended Dr. Peter Nelson, a professor of medicine at UW and a medical oncologist at Fred Hutchinson Cancer Research Center.
He cares about his patients.
He has compassion.
And I really respect that.
Brayman's tumor was biopsied and his DNA was sequenced as part of a treatment often called precision oncology or precision medicine.
Rather than using one-size-fits-all type therapies, rather than using fairly generic therapies, that the whole point is to try to tailor a treatment based on what the underlying genetic aberrations might be in their tumor.
I thought it was great because that gives us another way to maybe target instead of doing the shotgun approach of chemo.
In his case, there were two important implications. First, it immediately told us what treatment he should have for his tumor.
The other discovery, Brayman had an inherited mutation of the Bracha gene. In men, it increases the risk of prostate cancer. In women, it increases the risk of breast and ovarian cancer.
So then the question is, well, did other family members inherit it?
With our daughter, we invited her to Yakima and told her, it's not the conversation you expect to have with your children. Please get tested. You might have a higher percentage than the regular population of a fatal disease.
Alicia tested positive for the Bracha gene, which puts her at a higher risk of developing breast cancer. Now she works with her healthcare team to make sure she has frequent screenings.
Prostate cancer passes from father to son, but as our daughter shows, the mutation can go from male to female. And I've also heard it can skip a generation and then show up like with the grandkids.
But Todd and Helga decided not to tell their son right away. He was a UW student, but he was studying in Europe for a year. Soon after he came home, Todd broke the news.
I mean, he told Alexandra I was not home. I'll let him do that.
Well, it's not a diagnosis of cancer, it's just a possible risk factor. We don't even know yet if he's positive. He still needs to know so that he can be with it and deal with it and come to terms with it himself.
And he will do the test if I have to drag him here myself.
Todd is now on a PARP inhibitor, which prevents the cancer cells from repairing themselves. It's a medication typically used to treat ovarian and breast cancer, but Helga convinced a drug company to make the medication available to Todd, even though it hadn't been approved for prostate cancer.
Since it is the same defect that's in the breast cancer, that's in the ovarian cancer, the idea it should work, and they pursued it, and indeed it has worked.
People ask me what I want for Christmas, and I said a PARP inhibitor.
Dr. Nelson says Todd is responding to treatment. The Braymans are ready to face whatever the future holds, a future that gets brighter with each medical discovery.
Each year, our basic understanding of what drives cancer has improved dramatically, and now new therapies for some cancers are making huge impacts.